Are you ready to take control of your physical, emotional, spiritual, professional, and financial health? Are you ready to experience great success in your life? Each week, join Dr. Diane A. Thompson and her guests for tools and strategies to help you take control of your health and inspire you to live your best life. Now here is your host, Dr. Diane A. Thompson.
Welcome to Health Talk with Dr. Diane, MD. This is the show that is designed to inform and inspire you to a healthier lifestyle. I am your host, Diane A. Thompson, MD, and as always, it is my pleasure spending time with you on this broadcast with the goal that perhaps you may learn something new that may take your health and your life to a higher level. I will remind you that the information presented on this broadcast is for educational purposes only and is not intended for diagnosis or treatment. Please seek the advice of your healthcare provider before making any changes to your health.
My guest today is Dr. Cynthia Thaik, and she is a board-certified cardiologist and the author of this book, Your Vibrant Heart, Restoring Health, Strength, and Spirit from the Body's Core. Dr. Thaik, I wonder if you could, since we are in Heart Month and we're promoting heart disease awareness, can you talk a little bit about the risk factors of heart disease?
Yes, there are 5 major risk factors and then some very close correlated risk factors. So the 5 are high blood pressure or hypertension. There is close to 100 million Americans who have high blood pressure, and to this day the disease is still under-recognized and under-treated. And part of the reason for that, blood pressure is cyclical. It isn't a static number. And all too often, patients don't recognize that, and so they'll say, oh, my blood pressure is always normal when I'm at home. Yes, that's the case, but that doesn't negate the fact that you might still have high blood pressure because the blood pressure will elevate at other times. And so I teach my patients a simple rule. I have this 40-point rule that whatever blood pressure they're measuring at home, I want them to be able to add 40 points safely to that number and still have it in a reasonable range. So, for example, if they have a blood pressure at home of 110, add 40 points to that, it's 150. That's still okay if that's the highest number that you're going to reach in a day. But if they're monitoring blood pressures and they're receiving readings of 130, 140, then you know that they're going to be spiking up much higher during the day, and they really need to seek medical attention. Other issues, high cholesterol. I ask people, please make sure you know your numbers. You have to understand that in medicine you are a consumer, and when a doctor checks the lab, make sure you know what those numbers are, and not only know what the numbers are, but know what range is a healthy range, and if it's not in the healthy range, seek attention. There's so much information that's there on the internet and so forth, and guidance that you can receive from your physician. Diabetes is huge. It's the number one medical risk factor for the development of heart disease. And having diabetes is really synonymous with having heart disease. If you have diabetes, it's almost a foregone conclusion that you will develop some cardiovascular event. And so it is so critical for people to know their blood sugars, to accurately diagnose and hopefully prevent. And the diabetes is so closely tied into obesity and the way we eat. And so if you're outside of the normal weight scale, or particularly if you have that central obesity, which is part of the metabolic syndrome that we all are starting to hear about, that is, again, such a high risk for heart disease, then I would really take actions, because you'll find that these risk factors that I talked about, high blood pressure, high cholesterol, diabetes, and a metabolic syndrome, they all exist together. And if you develop one, it is very likely that the others will follow, and they add exponentially to heart disease. The other 2 risk factors that I want to mention is family history. Obviously, there's nothing you can do about your family history, but the awareness is key, and so you could take action and prevention of the other risk factor. And smoking. Smoking is something that is definitely preventable. It's within a person's own ability, and so those are the major risk factors.
One of the things you touched on is how important it is for people to know their numbers. I still meet patients today who will have tests done, different tests, and they cannot tell you what the results are. They'll simply assume that because someone didn't get back to them, it must have been okay. And I really agree with you that people really need to take better control of their health. They really need to feel empowered to ask what these results are. What do they mean for me? What do I need to do to get to where I need to be? You mentioned smoking. And in your book, you really have a unique take on smoking, where you even talk about the lie about smoking. Can you talk about your thoughts on smoking?
Yeah. So many patients and physicians as well, believe that smoking is addictive. And so that's led to $1 million industry, $1 billion industry with all these products that are out there to help people with smoking cessation. Right? And for me, I have a very strict definition of what addiction is. Addiction requires biochemical dependency, meaning that your body is dependent on the substance, and at the absence of that substance, there will be clearly definable, reproducible withdrawal symptoms. So, for example, alcohol is very addictive, or can be addictive. You can get the DTs, the tremors, the shake, you can have withdrawal seizures. Even caffeine for some people can be addictive, and you can have the vasoconstriction, the caffeine withdrawal headaches. But for me, smoking, and that's not to say people don't have a reaction when they stop smoking. Some people hallucinate, some people overeat, some people get really cranky and irritable and mean, but they're not reproducible, and they're individual. And quite frankly, I call all the reactions an adult brouhaha, adult temper tantrum. It's your body raging against yourself, trying to be the child versus the parent role of fighting, and I've seen this, and I'll tell you, I've through my years of practicing medicine and coaching, I have helped hundreds, if not thousands, of people stop smoking the day that they meet me, because I really empower them. I tell them the decision to stop smoking or not is yours. I'm not here to beat you up about that. Okay, I'm here to affirm that the day, the moment, the instance that you decide that you're going to stop smoking, you can. That's not to say that you might not have a reaction. That's not to say that you might not get irritable and cranky. But recognize and realize that there is no biochemical physiological response. We don't have an antidote for nicotine the way we do for cocaine and crack. And plenty of people, the day that they have their heart attack, the day that they go on bypass surgery, the day they have their stroke, no longer has that taste for the cigarette, and they do stop, and there's no problem. And so I truly believe that there is not a physiological addiction. There might be a psychological addiction, but again, that you control by making that decision. And don't fight yourself until you make that decision, but work with yourself to move towards being able to make that decision where clearly, with clarity and definity, you can let go of your cigarette. And when you do, it will be easy. I promise you.
I think if more patients take that view of it, then definitely giving up smoking will be a much easier feat than it seems to be right now.
What it does is put the control back into the patient's hand. And to me, I think self-empowerment, self-control is the key to achieving anything you want to do in life.
Agreed, and especially in attaining good health. I think that there's a big place for that. One of the things that you talk about is, and this is thrown around so much, and that's why I wanted you to address it a little bit, is the idea of detoxification. Just about everywhere you look these days, when people are looking at getting healthy, if they're looking at going on different types of diets, they talk about detoxification. And I know that this can mean different things for different people. So when you address the topic of detoxification, what does that mean for you?
One, I do think that detoxification is one of the three pillars of health, of good health, the other two being proper nutrition and fitness. But I want your listeners to really understand what detoxification means, because it has, it's a buzzword that has a lot of mystique to it, and too many people are swayed or influenced by different programs out there, different products that will detoxify the body. And I want to just caution people to really do their homework and not get so mystified by all the promotions that are out there. Your body is the best detoxification tool. Okay, your liver, your pancreas, your spleen, your lymphatic system, your blood cells, even the muscles and the skin. And so the detoxification process, you have the best machinery that exists within your body. To me, the core, the key component of detoxification is not adding more toxins in and allowing your body to do its job. And so the elimination diet, the elimination of the external factors, the exposures to even sunlight, which can cause a free radical, the fumes and the pesticides and the herbicides and all the stuff that exists in our chemical environment. And then in terms of the food, the processed food, the sugar, the animal protein, the dairy. And so there are certain foods that are soy, gluten, that not for everyone, but for a good majority can be toxic to the body. And so you do an elimination diet, you allow your body to do its own healing and do its own cleansing, and that's how you do a physical detox. I actually also want to put a plug in or mention an emotional detox. And I actually have a mental detox program. If anyone's interested, they can get a hold of me at info@drcynthia.com. But I believe so much in the toxic thoughts that we infuse our bodies with. And so equally important, if not more important than a physical detox to me, is a mental detox where you really free yourself of like I said, the stress, the fears, anxiety, the negative self-thought, negative self-image, and really learn how to lean into gratitude and love and appreciation. And so that to me is also really key, that people think about really detoxing their mind from the negative thoughts and emotions.
You touched on something. There is indeed a physical and emotional connection with health, don't you? Is that your take on it?
Absolutely. The Bruce Lipton in his thesis, talk about the conscious mind and the subconscious mind, and it's really interesting. He postulates that only about 5% of our thinking brain or our mind is being utilized, and that's what he terms the conscious awareness. Okay, and the rest of our activity of our daily existence is really being controlled by our subconscious, and our emotions, to me, are the gateway, the clues to what is going on within our subconscious mind. Emotions, energy, emotion. And when you don't have balance in your life, when your emotions and your vibrations are on a different plane, that gets reflected within your body. And actually, whether it's positive or negative, that is what then gets manifested within your body, things that are going on within your subconscious. And so I like to tell my patients, every thought, every emotion leads to just instantaneous cascades of hundreds and thousands of neurotransmitters and hormones and peptides and inflammatory markers and so forth. And they will either, play you a beautiful melodic symphony or, heavy metal music. It will either have positive effect within your body or negative effect, because those hormones and those peptides do cellularize within your body and either give you health or disease or dis-ease. And so there is absolutely a huge mind-body connection that people need to get interested in and be aware of and start shifting.
We'll take a short break, and when we come back, we will then address some of the specific things, such as the foods we eat, the things we can do to go towards attaining that vibrant heart. We will be right back.
You're listening to Health Talk with Dr. Diane, MD, sponsored by FMG Radio. Please visit Dr. Diane and browse her past shows and guest bios at fmgradio.com/Dr. Diane, MD. That's DrDiane, MD.
Welcome back. If you're just joining us, welcome to Health Talk with Dr. Diane, MD. My guest today is Dr. Cynthia Thaik. She is a board-certified, Harvard-trained cardiologist, and her book is called Your Vibrant Heart, Restoring Health, Strength, and Spirit from the Body's Core. And she just finished talking about that mind-body connection. And so, Dr. Thaik, I wanted to move into some of the more traditional things that people think of when they are looking towards attaining a healthy heart. So let's talk a little bit about food intake. What is your thought? Because this is another thing that's out there quite a bit, this raw food movement. What's your thoughts on raw food in order to help attain a healthy heart?
Well, one, I do believe in the raw food movement, or the benefit, and tremendous benefit that you can obtain. Just for your listeners who might not be aware of what that means, raw food is about consuming things that is not heated beyond 115 degrees, so that you have your basically a plant-based diet that is either eaten completely raw or just lightly cooked or steamed that doesn't get to that 115 degrees. This obviously takes the animal protein out of the equation, because that does need to be cooked, and so and there's tremendous benefit that can be obtained from taking a raw food, from starting with the fact that you're not destroying your minerals and nutrients and enzymes in the vegetables and that you're eating, and that you're getting the full complement of phytonutrients that this plant has to offer, which will obviously have tremendous impact on your cardiovascular health and your sense of overall well-being. But having said that, I do acknowledge that is a very hard diet to be able to consume and maintain. And so I don't want anyone to feel like, oh my God, if I can't, eat that type of way, that I'm not giving my body optimal health. I do want people to just start being a little bit, more conscientious. Again, going back to mindfulness in terms of how you do prepare your food. Try and blanch your vegetables. Try and lightly steam or rapid heat cook, your vegetables. I think for me, if I can influence people to not use oil in their cooking, because oil, when heated, tends to oxidize and can cause a lot of free radicals within your body. If you can think about sautéing with vegetable broth and sort of flash cook your vegetables, all of that will help to improve your nutritional intake and content.
And another debate that I see sometimes, and you actually address that in your book, is that of juicing versus blending. How do those things compare? Do you have a preference?
Yeah, I don't come down strongly on either side. I think that both has is unique benefits. So again, for the listener, juicing is when you take your vegetables or your fruits and run it through a juicer, and you get, the pure fruit or vegetable juice. And so juicing, what it does is take away the fiber. Okay, and so what the benefit of juicing to me is that it allows you to consume just that much more nutrients, because the juice is lighter, is cleaner, is not as bulky, but you get all the nutrients and minerals and so forth. Whereas blending doesn't take away the fiber, and so the fiber is left in, and with blending, you can't consume as much because it is just a thicker liquid and it's bulkier. But there's a lot of benefit to having fiber in your diet, too, because it cleanses the GI tract, the GI system. It helps to stabilize the entry of blood sugar into the bloodstream, and so it won't have as much of an impact in terms of elevating and spiking your blood sugars for anyone who's a diabetic. And so I really recommend doing a combination of juicing and blending, so you can retain some fiber within your diet, but also that that you do juice at other times just to get the greater quantity of fruits and vegetables into your body.
I actually do both, but I tend to lean towards blending more simply for convenience, because generally with juicing, if I'm rushing, I have to clean up, and with the blending, you simply drink everything that you blend. So, but they're both great. There's another thing that often comes up, patients who are trying to get healthy. And of course, there's so many organic foods out there, and people don't know which way to go. What's your suggestion on that? Do you need to go organic, or are you okay going the other way?
Well, generally, I do recommend organic for those that can afford it, but I do recognize that there is a cost factor. And so I write in my book, and I actually have a list, but I encourage the readers and the listeners to do their own research, because these information changes year to year. But there is a list that's put out of the clean, the dirty dozen, and the clean 15. And so there are a list of 12 fruits and vegetables that are more heavily affected by the herbicides and the pesticides. And then there are a list of 15 fruits and veggies that are part of that clean 15 list that doesn't matter as much whether you take organic or non-organic. Now, recently there was a Stanford study that came out that looked at the produce of organic and non-organic, and found that there wasn't any difference, or not substantial difference, in the nutrient content. And so the argument there was that organic wasn't as critical. But I want to remind the listeners that it isn't all just about the nutrient content. It is the pesticides itself and the herbicide itself that is on these produce, and that will get into your body. So again, when we talk about toxins and detoxification, a lot of these products do have estrogenic and neurogenic properties, and I firmly think that the uprise of all these neurotoxic and neurodegenerative diseases that we see in our society these days, and also the uprise of breast cancer and some of the estrogen sensitive cancers are due to the fact that our food supply has radically shifted and changed. Not just organic versus non-organic, but all the genetically modified organisms that are out there, the GMOs. And so I do encourage your listeners to be, again, advocates of their own health, to be consumers, to do the best that they can do, supporting the local farmer market, growing their own produce. I have this tower garden, which is a hydroponic tower garden, that I can, grow some of my produce. And so look for ways to be able to really help yourself.
That's great. And I did share similar information a couple of weeks ago on the radio, and uploaded the link for the Dirty Dozen and the Clean 15. And I will do that again for people, because so many people are trying to get healthy. And you're right, for some people, the cost of organic is just too much for them. So we definitely have to find alternatives that are also safe. Are there other foods, specific foods that you encourage for someone who's trying to attain a healthy heart?
Yeah, again, I think, to think in terms of whole food, plant-based medicine, being mindful. When you look at the food that you're taking into your body, just ask yourself, did this come from nature? Does this food have life? Did it have life? And if you just stick to eating food that will provide you life, and so green leafy vegetables, vegetables that are densely rich in colors, getting the rainbow spectrum of colors, vegetables and fruit, both of them, and then looking for food that will move your body into an alkaline state. And so again, you can go into my book, you can go onto the website, and there's all sorts of things that you can look up for having an alkaline-based diet, which is really the elimination of the acidic foods, the animal protein, the dairy, the sugars, the processed food, and shifting towards the plant-based stuff.
The book is called Your Vibrant Heart: Restoring Health, Strength, and Spirit from the Body's Core. And as we get down to our last few minutes, I would love for you to briefly touch on exercise. How important is exercise? This is something that we encourage, by the way, and my follow-up question is going to be, how do we get patients to do this? Because this is always a struggle. But touch on the importance of exercise in all of this.
Well, the heart is a muscle, and like all muscles, it needs to be exercised in order to have optimal health. And so exercise is super important. What exercise does is allow the heart to stay healthy. It helps to regulate the heart rate and the blood pressures. It definitely helps lower the risk of a heart attack and stroke. But in addition, it has other benefits. There's certain cancers that can be the risk of certain cancers can be decreased by exercise. Certainly, exercise will allow you to control your cholesterol and your blood pressure and even the blood sugars. And then exercise has such a benefit on the mind as well in terms of lowering the risk of depression, elevating your mood. It certainly helps with sleep. And so, how do we get our patients or our listeners to do the exercise? Again, I take the gentle approach. One is the education, the awareness, and the mindfulness. And secondly, just start where you are with what you have. And so if 10 minutes is all you can do 10 minutes, but stay consistent. Once you start the routine, keep it up. I think that even more important than the duration or the intensity is the actual act of, because in doing that act, so many things shift within your body, including your mindset. And so go out and start walking. And from walking, you could take it to a light jog or a run. Start out with 10 minutes, increase it by 5 minutes every week. And so that's usually my recommendation. I tell patients to start gentle and short. And from there, always aim to improve. So extend the duration, extend the intensity. Ideally, 30 minutes of aerobic type of exercise 5 days a week is what you should be aiming for. And actually, I don't want to say ideally, that's a minimum. And then from there, I usually recommend 45 minutes to an hour, 5 days a week.
Great. And as you said, meet people where they are. Start with what you have and just start and be consistent. And I think that's one of the best things. Now, I love to leave my listeners with a tip of the week, something that I feel they can implement right away and start on their way towards good health. And so for today, for someone who's looking at embracing this idea of having a vibrant heart, what is the first step you would share with them that would help them towards that goal?
Again, I think it's the recognition. It's the realizing that there is a higher plane that they can aspire to, that we want to be raising our level of conscious awareness to be able to really think into results. And so being mindful, setting a vision for the type of health that you will want, really clarifying in great detail what are the benefits, what are not only the physical benefits, but the emotional benefits that you would have from obtaining that health. Define it, have a picture of it, and just really meditate on it and be mindful of that and have that vision of that person that you want to be in your mind screen at all times of the day. And if you do just that simple act of visualizing and the person and the health that you want to have, you will start seeing shifts in your life. That inner guide that I talk about will guide you to all the right steps. Just need to follow and listen and be open. And so that's my tip, is being mindful, being connected, being present, and having that vision.
Dr. Thaik, thank you so much for being on the show.
You're welcome. And if I could let your listeners know how they can get a hold of me, they can go to either of my websites, is Dr. Cynthia, drcynthia.com, or yourvibrant.heart.com. And if they want to look me up on Facebook and Twitter, my handle there is just drcynthiamd. And so they can connect with me, and I love to hear from them.
Again, the websites are drcynthia.com and yourvibrantheart.com, and I'll make sure those information are also on my own Facebook page so that people can get a hold of that. Again, thank you for being on the show. And to my listeners, as I tell you every week, your health is your wealth, so do something healthy for yourself.
You've been listening to Health Talk with Dr. Diane, MD. For show replays and full guest bios, please be sure to visit fmgradio.com/Dr. Diane, MD. That's DRDIANE, MD.